My name is Sheena Webb. I'm a psychologist by training, but my current role is that I am the strategic and one of the clinical leads for the Pan London Family Drug and Alcohol Court team. And my role is really to oversee the progression of cases through the FDAC process, to support the team with clinical decision making. And through this crisis has been to support the team in thinking about how the service has needed to be adapted in response, obviously, to what's been going on. One of the things I'm very proud of is that the team has managed to sustain continuity throughout this period. So we never actually stopped functioning. We continued after a couple of weeks of thinking about what we were going to do to take referrals, and we've taken everything virtual. So in some ways, we've tried really, really hard to keep going and to provide some continuity for the parents who, for them, they've had their children removed. They're trying really hard to prove that they can do what it takes to have them back. And we were very keen to try and give them as much opportunity to keep that going from a justice point of view. However, of course, lots of things had to change. We weren't allowed, we immediately evacuated the office. We weren't allowed to do face-to-face. So everything went to virtual appointments, virtual hearings, virtual multi-agency meetings, virtual therapeutic groups. So we basically tried to do everything that we ordinarily do online. Or via telephone calls, because some parents didn't have the capacity to speak over the phone, as to speak over video call. They didn't have the technology or the ability. But of course, there's limitations to that, and so it has changed a lot of the way we work. And I think there's been some diminishing of some of the quality of contact in some ways because you're not doing face-to-face. On the other hand, we've had quite a lot of improved attendance at meetings and other things, so there's been a bit of balance. I mean, I think there've been several impacts. I mean, obviously some of the universal impacts about just being isolated and cut off from other people and practical access to things. I think for our client group specifically, there have been some really quite catastrophic impacts. So for parents who have had their children removed, many did not have any face-to-face contact for well over 3 months, including with babies and young children. Which was hugely impactful on an already extremely painful and distressing situation. I think on top of that, most of the treatment services either shut down or vastly limited their input. And of course, substance misuse treatment, a lot of it is group-based. And so parents suddenly we had nowhere to send them. They had no groups to go to, no treatment to access. So they were in this really difficult situation of, having had their children removed, desperately wanting to do what they can to have them back again, not even being able to see them or hold them for contact, and also not being really able to access the treatment they need to kind of achieve their goals. So I think it's been hugely, hugely impactful on many parents, and some just, have not been able to manage that. And others have found ways of overcoming the barriers. I think that one of the things I've noticed is it's been much easier to have multi-professional meetings, and meetings with people that you ordinarily just wouldn't be able to get people in a room together. We're across 10 local authorities, there's real distances. And so it's allowed for some really helpful problem-solving discussion between professionals that is not always that easy to organize because it's so time consuming. And I think that's been true also of the across the FDACs. We've been able to meet as clinical leads across the FDACs, and I think that again is really difficult to do when everyone's in different parts of the country. Suddenly we're all there on screen, and actually that's a forum where it's really quite easy. And within the trust as well, we had trust meetings. I was suddenly seeing people's faces I'd never seen before, so that was great. And you got the names, so you can put a name to the face. So there's been some increased connectivity, I think, through this. I think one of the things from our team we did, which we weren't sure was going to work, was that I normally run a parenting group and a group that's more around emotional regulation. And we just took those online. We've been running virtual groups throughout and having parents attend them. The Circle of Security Parenting, which is a program from the States, relaxed their license so we could use their material and stream it. And the parents have loved it and they've engaged. And in fact, you lose a bit of the face-to-face interaction, but we had much better attendance. Because I think there were fewer barriers to overcome for people to come in. And also I think for some people who are really anxious about being in a group situation, this is quite a helpful introduction to being in group, if you like, with other people without feeling too threatened by it. Some people could turn off their video, which again allowed them to titrate how much of a participation they were having. And I would add to that some of our parents have been accessing the fellowship meetings online and have really found that so helpful, because now you can attend a meeting anywhere in the world 24 hours a day. And so you're never alone. And again, they're massive meetings, there's thousands of people on them, but the parents have found it really supportive. COVID-19 has, in relation to what I was just saying, opened up the world of online working in a way that it was already there before. I used to do online therapy before this, but it was always a kind of second choice. And I think that it's forced us to all get used to it. And actually, it's made us realize there are certain things that we can do online that we don't have to do in person, particularly, I think, professional to professional. And as I said, that connectivity is so beneficial. And much easier to arrange now. I think that's something that we will definitely continue to do, to make sure that we don't not have these meetings because they're too difficult to organize and just take them online. I think I may well continue offering an online group alongside face-to-face groups when we're allowed to do that, to offer an access point for people who maybe aren't able to attend face-to-face or who aren't ready or don't feel able to. I think that might be something that we continue. I think from a culture point of view, one of the things I was thinking about recently is, I think, particularly I think in health and social care, we're a bit of a kind of, die hard, put yourself on the line bunch, come into work, no matter how ill you are, how tired you are, spread your disease to everybody around you. And I do really think that the sort of renewed culture of let's not spread germs and illnesses, let's be a bit more mindful, I'm really hoping that will stick, and that we all feel permission to take time off sick when we're sick, not just for ourselves, because we seem to struggle to do that, but at least do it for other people. And I just think that that may be a really healthy thing that we adopt into our work habits. Well, for me, it would be an extension of the goodwill that was prevailing during lockdown. I feel like when the lockdown happened, there was a kind of, wartime spirit. We're all in it together. Isn't the NHS great? We're all willing to go the extra mile. We're all willing to understand that everybody else is struggling and have a good bit of goodwill and give people the benefit of the doubt. I feel that has rather abruptly run out. at the end of lockdown. We had 21 referrals in 1 month. We're meant to have 8. And suddenly I feel like everyone's like, okay, now why aren't you doing this? Why aren't you doing that? Why aren't you doing that? And I doubt that we're the only service that's experiencing that. And I think that, you know, we need the opportunity and the space and the understanding to recover as a service, as the population needs to recover, and for people to understand that we're doing our best, and that may not always be quite good enough in terms of general service standard. We're trying our best, but we can't make it happen like that. And so for me, there's this fear of this expectation that we just suddenly spring back, and that's not happening, because we can't suddenly go back to the same working practices that we had before, but we seem to be being held to some of the same expectations, and I doubt that I'm alone in feeling that. I think the one point I wouldn't want to get lost really is the human experience of the birth parents who've been separated from their children. I mean, I think that that's kind of one of these tragedies that's gone a bit unnoticed in this crisis. I know that myself and some other professionals have been trying to kind of raise the awareness of this, but it really was horrendous. And I suppose what I would do is commend the bravery of some of the parents we worked with who really took it on the chin, and who could have kind of railed against the system and been angry, but accepted and understood that this was the situation and really kind of toughed it out through that period of not seeing their children, with their children crying on video calls and things like that, and who really kept going and had the faith, and who are now reunited with their children and hopefully on their way to a better outcome.